Good morning, and thank you very much for having me. When I first saw the theme of this year's TEDx event, Catalysts, Moments That Spark Unforgettable Change, it got me to reminisce and reflect about the key moments in my own life. Moments that translated into decisions that led me down my own entrepreneurial journey. An entrepreneurial journey that I'm going to share with you today. Close to 9 years ago, back in my hometown of Kuala Lumpur, Malaysia, I found myself utterly lost trying to look after my dad. His is a story that I think most of us in this room would probably relate to. A story of an elderly parent who was suffering from multiple lifestyle diseases. In the case of my dad, he was suffering from diabetes, cardiovascular disease, was slightly overweight, and unfortunately, as his condition deteriorated, for us as a family, we actively got involved in managing his health. And what we encountered absolutely shocked us. The system was broken, it was absolutely fragmented. In our case, it was deeply frustrating moving from hospital to hospital, experimenting with different treatment options, and meeting multiple specialists who never really communicated with one another. The whole system was fragmented, and it was so confusing navigating the maze that was my dad's health, especially as I don't come from a healthcare background myself. All he needed was someone to coordinate his care across doctors, diagnostics, and treatment plans. It seemed so simple, but yet it was not available. So incidentally, around that time period, our other founder, a family friend, Sanjay, was going through something very similar with his dad, who was diagnosed with cancer. Realizing that our experiences were not unique, we talked about how healthcare should not be so hard, and how we would probably get together and improve things. And these conversations continued until we had a complete plan to co-found a business that would address some of the issues that we'd face. We figured that patients needed to be looked after, just like how we went at painstakingly lengths to look after our own parents. We looked at countries where we would want to basically extend an integrated health solution specifically. Fundamentally, as a country, we decided that we would want to pick India, specifically because as a nation, India has 65% of health expenses borne out of pocket. Public health expenditure in India today is 5 times lower than some of its developed peers. And at the same time, health insurance penetration is still at an extremely nascent stage. And whilst from the onset, these macro indicators seemed extremely daunting, call it absolute foolishness or extreme courage, but we decided to make the plunge and come into India to essentially improve the quality of healthcare in a fragmented market. We chose a name, Connect and Heal, and before long, I quit my job, packed my bags, and moved to India. And whilst India is home now, at that point in time, it was extremely daunting, given the fact that we grew up in Malaysia for 3 odd generations. I did not know a soul in India when I first came over here, and at the same time barely could put 2 words of Hindi together. So don't ask, it was extremely difficult at that point in time. But we had a mission, and our mission was that we wanted to basically improve the quality of care, to bring about integrated health management, to essentially improve patient outcomes and also patient experiences. That was the broad vision of what we wanted to build. So now, when we first started, as entrepreneurs, we realized that we had this vision. How do we go about solving what we wanted to build for? For this, we essentially had to answer 3 main questions. Number 1, where do we get our patients from? So from this perspective, any company in the digital health space today ends up spending anywhere between 10 to 12 US dollars to acquire a customer. So any direct-to-consumer brand, it's extremely expensive to acquire a customer. And at the same time, because out-of-pocket expenses are so high in India today, you'd probably think twice, 3 times, 4 times before you basically part ways with your money. So you'll probably be checking multiple platforms in order to see the best deal that you'll probably be able to get to consume healthcare. So there's no real stickiness as well. So we had a challenge of expensive customer acquisition, no real stickiness, and unless you serve chronic patients, people don't fall sick every day. So there's no real lifetime value of a customer. And given that there is a double whammy across the board, not just in India but also globally, we decided that we would go after paying cohorts. segments of society that would actually sponsor healthcare specifically. We looked at the 3 main segments of society that sponsors healthcare globally. We looked at the government, we looked at insurance companies, and we looked at enterprises. Decided that we didn't want to do any B2G related work, and decided to focus and essentially serve both the corporate sector as well as the insurance sector. So question 1 done. Now essentially to say, okay, now that we've identified our customer segments, how do we go about catering to these particular segments altogether? I think from this part, this came somewhat naturally. It came somewhat naturally because we identified the pain points that these segments had. Unlike a lot of our peers in this space previously, a lot of digital companies were building healthcare platforms and then trying to connect the dots. We realized that healthcare is a touch and feel business. It's built on trust. And hence, we needed to master the art of offline delivery. So for us, we started running clinics. We started running clinics in corporate premises, so within offices, factories, etc. And we ran these clinics with our own doctors, nurses, ambulances across. This gave us a very strong clinical foundation, and at the same time realizing that very soon primary care is not complete without preventive care. So in this regard, we started partnering with hospitals, diagnostic centers, vaccination providers, primary health centers, and today we have over 50,000 cashless providers in 450 odd cities that we work with. So we've solved for primary care, we've solved for preventive care. We realized that the emergency response space was also super fragmented. Here we saw a company, again in the direct-to-consumer space, that was trying to build an Uber of ambulances within India. We thought that as a standalone business, it's an extremely difficult business to run, but because we were trying to build a complete ecosystem to look after every single patient intervention, we thought that it would be a fantastic complement to our overall offering. So we took over the team, the technology, the network, and after a series of improvements, today we are India's largest emergency response platform on the private sector side. We are basically the 911 of India, if you may, whereby we are able to deliver you an ambulance door to door in 25 to 26 odd minutes. So now the picture was nearly complete. We had primary care, we had preventive care, we had emergency response, and just when we thought we had figured it all out, COVID happened. And as an entrepreneur, this was one of the scariest moments of my life. At that point in time, we were a team of 76 odd people, 76 livelihoods that were completely dependent on us. And mind you, we run a physical clinics business at that point in time, and offices had shut down. Companies were not working. It was complete lockdown. I did not know whether we would survive. But failure was not an option. We had packed our bags, uprooted ourselves, moved to India, and hence we knew we had to make this work somehow. So we decided, we took a step back, and we decided to play towards our strengths. We had this emergency response helpline that we had taken over, and so 9118, 9118, like 911, you know. And we decided to rebrand that particular helpline to become a COVID-specific helpline. So overnight, what essentially happened was that we scrambled. We got a call center done up in 48 hours. We got our doctors to basically become digital. We essentially reoriented all our teams to start selling virtual care subscriptions to go back to our same corporate customers, so that, because it was all about survival at that point in time. We made mistakes, we dropped calls, but we figured things out as we went along. We were forced to scale ourselves overnight. Adapt, survive, thrive, and repeat. That was the mantra of what we were going through during that particular period. It was one of the biggest catalysts for us to become a digital healthcare company today, and that's the bedrock of the culture that we had built as well. So we survived wave 1, we were rebuilding, and then boom, wave 2 hits. Our phone lines crashed, team members got sick, beds ran out, testing was a nightmare across the country, our families were at risk, and I was barely getting 2 hours of sleep during that particular time. So much was out of our control, and yet people looked to us to control it. We were crashing, so it was back to the drawing board. And that's when the Plan B company was born. We realized that for every single aspect in healthcare, you needed to have a contingency. If one team falls sick, we needed cross-country, cross-functional teams. If doctors were not available, set up a separate bench strength of doctors, get alternative testing facilities. building for scale to ensure that we have the right latency and controls. We realized that in order to ensure seamless healthcare delivery at that point in time, we couldn't just rely on our third-party providers as well. We had to really control the entire value chain. That's when we started to invest in having people on the ground and to build our own clinical establishment as well. But most importantly, I think Wave 2 taught us mental resilience. There was honestly times that we felt that we hit a wall, that we couldn't go on. But then we'd have these little moments, getting someone to the hospital on time, getting someone an oxygen bed, or a simple email just of gratitude where our doctors or our teams had been able to help someone. It was the small wins that reminded us why we started this in the first place. And it wasn't just about holding on, it was about people counting on us and the lives that we would still be able to touch. That's what kept us pushing forward, not just to get by, but to build better healthcare. So yes, Wave 2 didn't just test us, it reshaped us into something new and a whole lot tougher. Now, in the post-COVID years, exiting the roller coaster that was the pandemic, we weren't just dealing with immense burnout over the past 2 years. But at the same time, we realized that we had to reinvent ourselves if we wanted to really provide an integrated healthcare experience. We knew as entrepreneurs, unless we disrupted ourselves, we would inevitably be disrupted. So the third question arose, what would be our third act? How would we use technology to provide a seamless solution for our patients? We answered this question by creating a unique online to offline platform that is able to support the needs of corporates, insurers, and families. This means that anyone with a health condition can connect to a doctor in under 90 seconds and be given the right healthcare intervention, be it diagnostics, be it medicine delivery, be it in-person consultations, be it a hospital bed, be it emergency management, etc., etc. And all this is done with a virtual care manager that is able to monitor your overall health and try to influence your health outcomes. Today, we embed technology in every single transaction that we do. For patients, we are using technology to improve care outcomes by providing personalized care plans with behavioral nudges and gamification. For providers, we are trying to bridge the issue of interoperability of health data across fragmented providers in the value chain. And for payers, our financial and clinical rule engines are able to digitize claims. We are able to assist in fraud prevention, and ultimately it leads to cost savings across the board. What's next for us? We want to build the country's most trusted health maintenance organization. This is much needed in a country where 65% of all healthcare expenses are borne out of pocket. We want to keep our patients outside of a hospital by monitoring and managing their care so that they're not burdened by avoidable diseases. To summarize, my journey can be broken down into 3 innings. The first taught me to dream big and take things step by step. The second helped me realize the need to be adaptive and resilient. And the third taught me that you need to constantly innovate to stay ahead of the curve. For any budding entrepreneurs who are listening to this or are in the audience today, my advice would be to, number one, get a mentor. I think learn from others who have walked that path before you. We were very fortunate after our Series A, our investors have become fantastic mentors to us. And trust me, it'll save you a lot of time, it'll save you a lot of money, and if you're lucky, it'll save you a lot of gray hair as well. Second, I think understand how to achieve product market fit early. Understand the why, understand the who, understand the how you'd want to basically serve your customers accordingly, and you'll be okay. And thirdly, I think never take your eye off the financials, because passion keeps you going, but ultimately it's the numbers that help sustain you. So lastly, I'd say enjoy the little moments as well, because trust me, the little moments do add up. And when viewed in hindsight together, you never know which of those little moments become your catalyst to provide real change and impact. Thank you very much.